So, Michael, this is great. What do you think of the experience at eHealth this year?
Well, I've really enjoyed it. I've enjoyed talking to a lot of physicians. I'm really pleased to see a lot of physicians here who are really bought into the whole eHealth agenda.
Are you finding that there are differences between sort of now that they've got EMRs and there's that whole push within the provinces to get them on board, and now we're introducing things to consumers? Do you think there's been a shift at all with physicians in the community?
We're getting to a point where there's actually enough physicians involved in actually using electronic health records in their practices that they're now real partners in the game. Now, of course, the excitement is connecting them up to the hospitals and the other parts of the whole healthcare continuum so that we can all operate as a single team working for a patient.
I think that's a great idea. I think breaking down the barriers is really important so that information can be exchanged. Well, how do you feel being our new CMO? We've just appointed you Chief Medical Officer. How do you feel about that?
I'm very excited about it. I'm very excited about working with the Telus team. I think the team's fabulous. I think we've got a great set of assets. And working with the medical community to put those assets to work in the service of patients. So I'm very excited about it.
Well, can you tell me a bit about the physicians advocacy group that you're putting together? I'm not sure if advocacy is the right word, but you're putting together some kind of a group to talk about issues in eHealth?
Well, when you look at a lot of countries, particularly in Europe, that have been really successful in eHealth, there's a real identifiable physician leadership community that's helping to shape that agenda. We haven't seen that really develop in Canada in the same way. So I think Telus' agenda is to try to create a dialogue among some of the interested physicians across the country to start to create that leadership forum and that place where we start to think about how technology is going to change practice.
So you're looking at it from a very clinical level in terms of how can technology impact outcomes and patient experience and cost efficiencies? Would that be correct?
Yeah. So if we don't change clinical practice to take advantage of the technology, there's no real benefit. Technology is just replacing paper. We want to do more than that. We want to create an ecosystem around the patient so that we can practice differently, interact with patients more frequently, give them a sense that we're always there to help them. And that's going to take some different ways of doing business. And the physicians have to be part of that redesigning how they practice.
I agree, and it's interesting when you say it's the business. I think a lot of physicians certainly see themselves more as healers, I think, first, but business people second. And I think that shift may have to happen a little bit because they still have to have the patient focus, but they have to understand that their times are changing. And it's sort of like with the technology we have now, it could almost go back to the old-fashioned house call, but you just do it electronically with patients.
Yeah, well, in part, yes, but I'll add something else. As healthcare becomes so complicated, it becomes fragmented, so people are giving little pieces of the care that a patient receives, but they're not giving it all. So we need to knit together all those fragments again. If you go back 100 years, you had one doctor that you dealt with, and that was it. There was no such thing as a specialist. There was no such thing as a diagnostic test the way we think of it today. And as we've created this technology, we've had to subspecialize and break things down into little pieces. We now need to use technology to knit that all back together again to have a really positive experience for the patient.
And how do you think government fits into this? I mean, there's always that yin and yang, if you will, about, governments are all different across the country. Do you think we need more of a federal mandate? How do you see government fitting into this transformation?
Well, there's no getting away from the fact that government is paying for healthcare on the behalf of Canadians. So as the payer, the government is responsible for creating an environment where the incentives are there to improve care quality, to improve the efficiency of care. So we have to partner with them to understand, so they understand when they're designing their payment schemes, where the opportunities are to improve efficiency and improve quality as a result of some of the technologies. So, there's some barriers that we're starting to see fall. We're starting to see governments, for instance, paying for doctors to spend time on the phone or to communicate with patients by email. That's been a fixture of European healthcare systems for a long, long time. We're now just getting on board to the idea that, gee, maybe we should use email and phones to communicate with patients.
Revolutionary.
Big revolution. But it's an example of how payment schemes can block the adoption of technology, and I think governments are starting to realize that they need to enable some of this to move along with some policy changes around that.
It's interesting because you keep talking about the European countries, and I agree, we've got Denmark, we've got a bunch of other places that are pretty much there. I mean, they've got EMRs, they've got EHRs and everybody, but they're small, they're kind of contained countries. Canada's so spread out, we've got a small population, but we've got a huge, real estate to cover. So, do you have any comments on how we can break down those barriers and silos that exist sort of across that large country that we have?
Yeah. Well, I mean, that's one of the things I'm very excited about TELUS. Because clearly, TELUS is all about reducing distance and shrinking time and, mobilizing technology to be wherever people need it. So I think we can offer a lot in trying to solve that problem. But when I look at some of the European countries that I think have really done some great things, nobody's done the whole thing. So, you can go to Denmark. Denmark's fabulous in the primary care space. Go into their hospitals. They're not as far along as Canadian hospitals.
Oh, okay. That's interesting.
So it's a little bit, it's a little bit spotty. But I think the Europeans have done well in primary care generally. And that's where our investment is going to reduce the burden on hospitals and keep people well and keep people out of the hospital. So they've done a better job of controlling their costs by focusing on the primary care space. We tend to focus in North America more on a high-tech space inside hospitals, which is important, but obviously if we can keep people out of the hospital in the first place,